Welcome to the momsAWARE Water Damage Awareness video series. I'm Andrea Fabry.
And I'm Kristina Townsend.
And we are here to help address some concerns of any type of water intrusion into an indoor environment. And today we're going to talk about the issue of treatment and how overwhelming that can be when you've connected up your health with the environment. Kristina, where do you begin?
Well, it's such a big question because not everybody is the same. Not everybody will need the same treatment. There is no one package fits all. So it depends on the type of exposure you had and the extent of the medical situation that you're dealing with. It also can vary from doctor to doctor on treatment. But if you cannot get to a medical, somebody who's qualified who knows how to deal with mold exposure and mold illness, biotoxin illness, the first thing I would do is recommend that you change your diet, removing anything that's processed. Sugar is a key.
Sugar feeds fungus, so when you take away its food, just like in the drywall, that feeds the fungus in order to grow because that's presenting a food. It's the same thing with the sugar in our food.
Right.
So that is typically one of the first things to go. And I know that's hard, but that can be a huge help.
Huge help. Anything that's starchy. You want to get away from any food that is white. That would be your breads, your rices, your potatoes, because those also feed mold. So you want to remove those. Then
the issue of avoidance. That's a big treatment. The number one treatment, and any mold specialist would tell you that as well. And that can mean varying a range of things. Kristina, is basically cleaning up the environment, the very environment that made you sick.
What's interesting is that 75% of most mold patients also become what we call chemically challenged. So all of a sudden, when you use Pine Sol, Lysol, fragrance, personal hygiene that personal products that you've been able to use for for years with no problem, all of a sudden make you ill. So it's not just cleaning up your diet, but cleaning up your indoor air environment. You go as least toxic as possible.
Less chemicals.
Less chemicals.
And sometimes it means leaving the very environment that you've been living in, correct?
Correct.
It can be a radical treatment.
Correct. For some, it's an absolute must that they leave their environment. If they become what we call hyperreactive, your immune response is instantaneous to the smallest amounts of spores. We want to remember that for mold patients like ourselves, when we become hyperreactive, we want to think of how small these spores are. And one of the things people don't realize, these spores can actually 250,000 fit on a needle head. So just a fragment of that spore.
Okay, so I've got a needle, so that's 250,000 spores on that needle head.
Right, correct. And just one of those little spores can actually make you reactive and make you feel very, very ill. And so that's where it comes, the important part of removing yourself from the environment.
Lots more to say on treatment, but I hope that helps get you started. Thanks for watching this edition of the momsAWARE Water Damage Awareness video series.